Myself, Dr. Jineshwar Yaligouda. I am a professor and HOD Department of Anatomy in the Gulabra Patil Homeopathic Medical College. Whatever we are going to study today is the dissection of the lower limb. So dissection of lower limb is very important, where we can study the different structure. As we have in the dissection practicals, we have completed the lower limb dissection. So I am going to demonstrate the dissected part of the lower limb here. Today we are going to proceed this is the one which is, you can see the area of the front of thigh. So front of thigh is within the area between the anterior superior iliac spine, and we have the pubic tubercle and inguinal ligament. And with this we have the greater trochanter here, and also we have fold of groin, and we have the medial condyle of femur, lateral condyle of femur, patella, and we have the tibial tuberosity. So within this area we are going to call as an area or the region of the front of the thigh. When we dissect the front of thigh skin, we reflect it laterally, and we are going to see the skin superficial fascia. Then afterwards we are going to see the muscles of the front of the thigh, including, you can see, this is the area of the femoral triangle. You can get the area of the femoral triangle, and these all are the muscles of the front of the thigh. So first we are going to study the one muscle. This is known as a sartorius muscle. This muscle, which is we call as the longest muscle of the body, which is originating from the anterior superior iliac spine, inserting at the upper part of the medial surface of the tibia. Other muscles in the front of thigh are, here you have, this is a muscle which is we call as an vastus medialis. Then this is a rectus femoris muscle. This is, then below this we are going to have the vastus intermedius, and this is laterally, where we can see here vastus lateralis. So vastus lateralis, rectus femoris, and we have below this vastus intermedius, and this is a vastus lateralis. So these all are the muscles which are included in the front of the thigh. Next, going to the deeper structure, when we go to the deeper structure, you can see the boundaries of the femoral triangle. Laterally, we are going to get the medial border of the sartorius, medially by the medial border of adductor longus muscle. Adductor longus and sartorius. And here above, superiorly base is formed by the inguinal ligament. So next, what are the content of the femoral triangle? You can see here contents are the, you are going to get this one, which is we are going to see as this is a femoral vein, and this is a femoral artery. This is a femoral artery, and this is a femoral vein, and we have, this is a femoral nerve. So femoral nerve, then we have the femoral artery and femoral vein. So from medial to lateral side, a relation of the femoral vein, then femoral artery and nerve from medial to lateral. These are the major contents of the femoral triangle and boundaries. Then next, going to the next part, at the middle of the thigh region, here you can see the, below this sartorius, we are going to get as a adductor canol. This is also called as a subsartorial canal. What is adductor canal, hunter's canal, or subsartorial canal? This is what, which is, you can see here the medial side of the middle 1/3 of the thigh. Below the sartorius muscle, there is an adductor canal. You can see the content of the adductor canal. You can see here saphenous nerve, and you are going to see the femoral artery and femoral vein in the adductor canal. So this is all the anatomy of the front of thigh, including study of the femoral triangle and adductor canal. So this is a main important dissection part. This is the dissection part of the front of the thigh region.